Ehab Salah is advisor on prisons and HIV, as well as the UNAIDS focal point for the UN Office on Drugs and Crime. He's a medical doctor specializing in medical epidemiology and public health, with more than 20 years of hands-on experience in communicable disease research, prevention, and control. Prior to joining the HIV/AIDS section in UNODC Vienna in 2014, he coordinated UNODC's HIV in Prisons program in different geographical regions since 2006. Dr. Salah, would you like to speak on this time, or given that you've just signed on, would you rather speak after one or two of the remaining speakers?
Hi, David. Hi, everyone. Yeah, I can speak now if you allow me. So, so first, thank you very much for giving me the chance to present in this important side event. And yeah, I'm glad to be with you today. I don't know how much time do I have?
Up to 10 minutes.
10 minutes is fine. I'll try to wrap up my presentation on time. And let me introduce myself quickly. My name is Ehab, and I work for the United Nations Office on Drugs and Crime. I'm coordinating the UNODC work on HIV in prison settings. I've been requested to share with you some data, information about the current situation and service coverage related to HIV and other infectious diseases in prison settings. Again, so let me start with the situation in prison settings and where we are and what are the vulnerabilities of infectious diseases and people in prison settings. It's very clear that the majority of prisons all over the world are suffering from overcrowding, and in many countries in prisons there is overrepresentation of people, of key populations like people who use drugs, people who inject drugs, sex workers, men having sex with men. Just all of them, because of the punitive laws, are overrepresented in prison settings. And prisons is not separated from the community. All modes of transmission are there, including through injecting drug-use contaminated injection equipment, as well as sexual contacts as well. In many countries, the health profile of people in prison is lower than the community. This is where they're coming from. This is coupled with the low access to evidence-based and human rights evidence interventions for HIV, TB prevention, treatment, and care. Also, the current situation, living condition and working condition in prison is not at the same standard as in the community, not speaking about the high level of stigma and discrimination that's associated with people in prison, people who use drugs in prison, people living with HIV in prison, and of course, genders in many countries. One of the major things that hit us very hard, especially during the COVID-19, is the prison health system is being isolated from the public health system. And this has been noticed in many countries during the pandemic of COVID-19 in many countries, where many countries found itself isolated from the public health system. This means that they don't get enough resources, including testing and treatment. We are talking about a total population of 10.7 million people in prison at any given day. 10.74 million people, according to the latest release from the International Center for Prison Studies. 10.7 million, and of them we have like 7% women. So the latest report indicating that there at any given day is around 714 women in prison at any given day. What about the situation of infectious diseases? According to the latest report came from the UNAIDS global monitoring, as well as some global burden studies released in 2016 in the Lancet, it says that HIV in prison is 4.7%. This is the average prevalence of HIV in prison, 4.6%. And this makes people in prisons like 7 times higher than the community. When it comes to hepatitis C virus, the prevalence is 15%, 4.8% for chronic hepatitis B virus, while 2.7% of people in prison are suffering from active tuberculosis as well. COVID-19, we're still tracking some data, but we are not aware of what is the prevalence, what's the current situation. We're still learning and trying to create some platform where we can collect some data on COVID-19. We're still working on this. However, most importantly, HIV and tuberculosis are still one of the major causes of death and mortality in prisons in many countries. Some data I want to share with you that UNODC, we released recently the Global Drug Report 2020 that has been released like a couple of weeks ago. And it has some data on drugs and people who use drugs in contact with the criminal justice system. The survey conducted in 2018 and its data presented in the World Drug Report indicated that in 1 year, there's 3.1 million people arrested because of drug-related offenses. 1.2% are related to trafficking, while 1.9% are because of the possession of drugs and the use of drugs. This is the data for 2018, and I would like to invite you to have a look at the World Drug Report where you can find more details about this. This 3.1 million people came in contact with the criminal justice system in 1 year. 1.6 of them were convicted. This means that, as we speak, if we talk about 10 million people in prison at any given day, the total number of people who are in prison because of drug-related offenses is 2.5 million people as we speak today. This is like 25%, and this percentage can go higher in other countries as well, in many countries. Speaking about the regional prevalence of HIV and TB in prison settings, you will see that there is a lot of regional diversity. So in some regions like East and Southern Africa, you will see the highest prevalence can reach up to 15% of the HIV prevalence among people in prisons. While in other regions, you will see that hepatitis B is really high, like in West and Central Africa, where the prevalence of HBV, hepatitis B virus, can reach up to 25%. Other regions, hepatitis C can be higher, like Asia Pacific and Eastern European Central Asia. This is where the diversity of the or the regional diversity of the prevalence of infectious diseases in closed settings. This is why UNODC and other UN agencies, including WHO, UNDP, and ILO, UNAIDS, of course, as a partner with us in all our initiatives, we came up with a comprehensive package of 15 key interventions where countries can adopt to deal with issues related to HIV and other infections in prisons. These 15 key interventions are focusing on the prevention of HIV, HCV, diagnosis and treatment, gender-responsive interventions, including sexual and reproductive health, prevention, diagnosis of tuberculosis, as well as occupational hazards, because when we talk about infectious diseases, we should not exclude people working in prison. So one of the interventions is related to the occupational safety for people working in prison settings. So this is the set of interventions. And what about the situation? What's the current situation? What are the service coverage? So UNODC commissioned a survey in 2018 to measure the coverage of these key interventions. I'll share with you some of the facts for your information, and some of them related to HIV prevention among people who use drugs. So the report indicated that, first, the report is covering 189 countries. And out of this number of countries, only 57 countries provide condoms for people in prison. Only 56 countries provide OST, or opioid substitution therapy, for people who use drugs in prison. At the time of this report in 2018, only 11 countries have needle and syringe program in prisons, and only 79 countries perform HIV testing, voluntary confidential HIV testing for people in prison, while 88 countries reported the availability of antiretroviral treatment in prison settings. This gives you an idea about the situation when it comes to the services available. We have a huge gap in service provision in prisons and other closed settings. For example, if we focus on OST, opioid substitution therapy, and needle and syringe program, you will find, as I said, that only 11 countries in the world implementing needles and syringe program in prison settings. What's the regional distribution? You will find that 5 out of the 11 are in Western Central Europe and North American countries, while in many regions, this service is not available at all. So in Western Europe, North American countries, many of the services provided there, while where the prevalence are high in other regions, it exists or it doesn't exist at all in many countries. This is the current situation, and this is why we are very much concerned about this. We're working with member states to ensure that people in prison have access to evidence-based and human rights interventions for HIV, TB, and other evidence-based interventions in prison settings. So what we are promoting is improving monitoring and evaluation of services, especially regarding to key population in prison settings, encourage the voluntary testing and treatment for people in prison, reducing overcrowding, and now we talk about COVID-19, and promote compliance with the Nelson Mandela rules. I'm sure you are aware of the United Nations standard minimum rules for the treatment of prisoners. These rules, also called the Nelson Mandela rules, it has been adopted by the United Nations General Assembly in December 2015. And within these rules, there is specific rules addressing the health of people in prison, saying or indicating that healthcare services in prison should be equivalent to those provided in prison, and also in emphasizing the importance of the continuity of care for people in contact with the criminal justice system. Our website, we have a lot of publications. You can look at it and you have to see it. But for a minute, if I have one more minute, I can talk about COVID-19. This is the topic of the hour. And COVID-19 and its virus, SARS-CoV-2, hit prisons very hard. And we have been faced with many, many issues related to prevention, preparedness, and control of COVID-19 in prison settings for so many reasons, including the overcrowding, where we talk about one of the major measures for the prevention of COVID-19 is physical distancing, which is not an option in many prisons all over the world because of the overcrowded prison. And this brings to us the long-standing call of the United Nations to reduce overcrowding and utilization of alternative to imprisonment for minor non-violent crime. And here I would like to mention that the United Nations General Assembly special session on drugs and the world problem of drugs, indicating or encouraging member states to utilize alternative to conviction or punishment for tiny or small non-violent crimes, including the use of drugs. I leave it there and back to you, David, if there's any questions I can respond to, if possible. Thank you very much.
Thank you. We do have some questions from the chat, a question from Eric Sterling, the longtime, now former president of the Criminal Justice Policy Foundation. Since about 1/4 of the world's prisoners are in the US, is your data on the imprisoned especially true of the US, or does HIV, tuberculosis, etc. in the US skew the global data? For the lack of health care and the prevalence of disease in prison, is the US near average or greater or lesser than the rest of the global average?
Okay, thank you very much for this question. The total number of people in prison, as I mentioned, including people in prisons in the US as well. And as I said before, this is the data that we got from the International Center for Prison Studies, and it has a release every couple of years about the current situation of people in prison. And you can go and visit yourself and get some more information about the number of people per country. It's available with the current situation of overcrowding and the staff and number of facilities and so many other data. You can get it from there. And regarding the average of the prevalence, I'm not sure about the average this. I might need to get back to the current situation right now. What I have shared is the global situation, which includes the data came from a literature review, also a questionnaire and survey that has been shared with all member states. But this average, I don't have an answer right now, but I need to get back to you, to David, and he can share the answer with you. I promise he can do that.
Okay, thank you. And thank you again very much for joining us. We do have a comment and question from Andrew Tatarsky, who is very concerned about the likelihood that lethal overdose will rise during the pandemic. So this is a question for any speakers who have information on this, or anyone else. Feel free to share in the chat or by speaking later. But what has been observed officially, and how might we anticipate and mitigate this this looming crisis?
Thanks, David, and thanks for this important question. And I would like to share the same concern about the level of overdose mortality. Maybe I should have mentioned in my presentation that people in prison are at a higher risk of the fatal drug overdose and the mortality related to drug overdose, especially upon release. And there's a study that has been released in 2010 between WHO and UNAIDS. It's indicating that people released from prison, they are at 40 times higher than the general population to suffer from mortality, high mortality related to drugs. This is why we always promote, part of our comprehensive package is the promotion of prevention and management of a drug-related overdose, especially upon release. This is very important. Yes, this is a very concern, and we promote this, and we encourage member states to adopt measures for overdose prevention and management, especially upon release. Most importantly is also, during the COVID-19, some countries started to release prisoners as one of the measures to reduce overcrowding. This is fine, and we are promoting the reducing of the overcrowding in prison, but we need to highlight two major issues. Number one is the linkages with community health care services. We cannot just simply release people without linking them to community health care services. Some data from countries indicating that these people, they lost the gains that has been conducted in prison. And the other thing, which is also very important, is to ensure that when people are released, we need to select specific categories to be released, and also to make sure that it's not compromising the public health and safety. Back to you, David.
Okay, thank you. And I know that Dr. Tatarsky, who posed that question, posted a link to an article he published in Psychotherapy Networker on changing attitudes towards addiction treatment. And I'll be doing a summary of information like that later on, but everyone be sure to check before you sign off.